Thank you all for the incredible work, the sacrifices that you are making in caring for our patients, your families, and each other. This unprecedented crisis has put a strain on every aspect of our society, and healthcare has been disproportionately affected because we are the solution. We are the refuge that people are seeking at this time. As this crisis continues, I know that there are times when all of us are concerned. We feel scared, we feel ill-informed, we feel frustrated, and quite simply, we just want this to be over. Unfortunately, there are many more questions than there are answers at this time. What I do know is this: our system, through the efforts of our brave heroes in both clinical and non-clinical areas, has risen to this challenge. We have gone through rapid cycles of improvement on the best ways to protect and to treat our patients, our staff, and our community. Just a short 4 months ago, the healthcare community worldwide was unaware of this virus. The first patient in China was believed to be around November 17th. The first patient in the US was around January 20th. And the first patient in our system was on March 20th. Since that time, we have rapidly adapted to this challenge, modifying our ICU and ventilator capacity to fit up to 47 additional ICU beds in our facilities. We have implemented treatment protocols at breakneck speed as they have been developed across the world. LGH was one of the first hospitals to implement Cepheid rapid testing for COVID-19, and we have added 180 physicians locally that have performed over 4,000 telemedicine visits so far. And we are now averaging over 45 urgent care visits per day on our Health Anywhere app, and have become a statewide provider for telemedicine for several health plans and employer groups. These rapid changes are a result of our culture, our Journey to Excellence culture internally, and the Cajun culture that makes our community so unique. One example of that is the Cajun cover-up, inspired by an idea from Karen Robeson and manufactured by Action Specialties in New Iberia. These masks are allowing us to extend the life and the use of our N95 masks, and are also assisting us as we begin masking all staff in our patient care facilities system-wide. These walk-around masks, or WAMs, are being used to assist in stopping the spread of this virus. I encourage everyone, and also your family and friends, to begin wearing a homemade mask or covering your face when you're in public and cannot reliably keep yourself socially distanced from others. We've seen heroism throughout our system. The work of our critical care staff cannot be overstated. From the extra pounds of PPE they are wearing, the increased body temps that they are enduring as they carry out their work, and the anxiety and the stress that is following them as they care for these critically ill patients. We can never say thank you enough. Many of our med-surg units system-wide have been converted to COVID units. The sacrifices of these teams and the support staff that assist them have been remarkable. Also, with many of our outpatient sites and most of our surgical services being closed or at minimal activity, hundreds of staff have been repurposed and been placed in new positions and new roles in the last few weeks. Please know that your new care coworkers appreciate your help and the sacrifices that you're making. From what we have seen around the world, we have a lot of work that still lies ahead of us. I do not know when this curve will bend, and I don't know when this will be over. We must keep our focus on our patients. We must constantly remember our calling to care for others, and we must continue to be steadfast in our commitment to the safety of our fellow coworkers. Once again, thank you for your contributions to these efforts. May God send His blessings, His comfort, and deliver His protection to each of you as we face this pandemic together.